if 100 people have the disease, what percentage will have that mild disease as you described, and then what percentage might die based on what we know so far? And we know it can change.
Yeah, based on what we know so far, 80 people have died out of the total number of people that have been reported. It's about 4%, 3 to 4%. That is a very early number in terms of percentage, and that will likely change as more information becomes available.
So 80 of the 2,000 plus
2,700, yes.
Or the percentage of people who died, who have died of 2, 3, or 4%.
Yes, that's right. That's
now,
right.
that doesn't mean it's not severe. It doesn't mean it's not a dangerous disease.
It just means that everybody that's infected will not necessarily develop severe disease and die. So when we do surveillance, when we look for cases, we tend to look for people who go to healthcare facility and go to hospital, and those are the people that have disease. What we don't pick up from surveillance systems are those that have the more, we call the mild end of the spectrum of disease. And it's important that as Chinese authorities continue to look for cases, they may find individuals who have more mild disease, and that will likely change, the proportion of people that die.
Will change over time.
Yes.
Now, I was asking, how does the virus spread?
So, Kashif, that's a very good question. What we're trying to understand, what we know from reporting, is that transmission occurs through a respiratory route, which means droplets. So these are small particles that either transmitted through like a sneeze or a cough. But transmission between people occurs amongst very close contact, so family members or healthcare workers. So you have to be in close proximity to one another. We also know that this is a coronavirus, and the original source of this outbreak is likely an animal source. We've seen some reports that it's possible that people who don't have any symptoms can transmit to other individuals. This is what we call an asymptomatic person could potentially transmit. We've only seen some case reports of this, so very few numbers. With other coronaviruses, such as Middle East respiratory syndrome coronavirus, we know that this is possible, but it's happening in a very limited extent. It did start in this area of Wuhan, but there is some circulation in other cities in China. And of all of the people who have traveled from China to another country, there are some cases that have traveled from China to another country. Those people have typically been mild, and there hasn't been any onward transmission. There haven't been any outbreaks in other countries. And so not everybody across the globe is at risk for this virus. It's important to know where the virus is circulating, and so you can determine what your individual risk may be.
So it's in 12 other...
We haven't seen any evidence that the virus has changed or that it has mutated, but it is a common question that comes, since this is new, this must be different, this must have changed. But we're watching this very closely, and we haven't seen any evidence that it's mutated or that it's changed.
Not for now, but keeping an eye on it.
That's right.
Okay.
This is a tough one. This is a good question, because when someone comes in with a respiratory disease, it's very difficult, if not impossible, initially to determine what they're infected with. And so what we rely on are diagnostics. So I should say very, very quickly after this virus was identified by Chinese authorities, they made the sequence available. So this is the part of, what is this virus itself? They made it publicly available. And because they did that, diagnostics were molecular tests, like a PCR test, were very quickly developed. And so lots of countries can actually test for this virus. So if somebody comes in with a respiratory disease, they will take a sample, usually like a respiratory swab sample, and run a test. Is it influenza? Is it coronavirus? Is it something else? And so, for example, for MERS coronavirus, there's a clinical trial that's ongoing right now in Saudi Arabia that's looking specifically at the use of some potential therapeutics for those patients. And we're hopeful that clinical trials could be used for this novel coronavirus as well.
And there's already, you said 2? There's already 2 underway?
It's a new virus. Yep. We don't have specific treatments for that virus. But because this virus causes respiratory disease, those symptoms are treated. We've heard a lot about antibiotics. And this is a virus, so antibiotics won't work against a virus. No. So, but I should say that there are treatments that are in development. And this is really important because for the past many years, many treatments are being looked at to treat other coronaviruses like MERS coronavirus. And hopefully those treatments can be useful for the novel coronavirus.
And how do you go about